Living with ADHD is like walking up a down escalator. You can get there eventually, but the journey is exhausting. Kathleen Ely. Before any prescription is written, your physician should gather a detailed patient and family history regarding the presence of any cardiovascular disease. A focused cardiovascular physical exam should follow, along with your child's baseline height, weight, blood pressure, and heart rate. This is important because the stimulants used with ADHD can cause an increase in blood pressure and heart rate. A doctor wants to be sure medication isn't going to cause an unnecessary complication. In addition, the presence of potential medication side effects should be explored before any medicine is started. It will be important to know which is the cart and which is the horse, should any of these reactions occur. These include, among other things, sleep disturbances, abdominal pain, moodiness, changes in appetite, headaches, and tics. Tics are sudden, repetitive movements or involuntary sounds, such as eye blinking, shoulder shrugging, facial grimacing, or throat clearing. They can sometimes be a side effect of ADHD medications, but more often, the medications are unmasking a pre-existing problem. That's why it's important to explore these things ahead of time. If your child is an adolescent, there should be a thorough assessment for any existing or potential for substance use or abuse. Once we've done these things, it's important to make sure you and your child, if age appropriate, understand the purpose of treatment with medications, how they work, what problems to look for, and what to expect. If there is no history of appetite problems, tics, or sleeping disorders, these specifically need to be discussed as possibilities and addressed should they arise. This is the time to ask questions. A lot of them. Make sure you get the answers you need. When the decision to start medication is made, understand that it will usually take from 1 to 3 months to determine the best medication, dosage, and frequency of administration for your child. Keeping that in mind will help avoid frustration during this adjustment and finding the right dose, especially with the need for frequent follow-ups, maybe weekly for a while. Remember, one size doesn't fit all. And to help drive home that point, here are some things to consider before selecting a medication. The duration of the desired medication coverage. Short-acting stimulants last about 4 hours. But what are we trying to cover? Is that enough time? Does the window need to be extended to mid-afternoon or early evening? The time of day the child's target symptoms are the worst. Whether the child can swallow pills or capsules. Whether the medication could or should be given at school. Whether there are pre-existing problems, such as tics or headaches. The potential side effects of a particular medication. Whether the child has a history or potential for substance abuse, or someone in the home has that potential. The cost of the drug. In general, short-acting stimulants are much less expensive than the longer-acting ones, and generics are less expensive than brand names. And while generics work just as well as brand names, they're not always available in the same dosages, making their use more problematic at times. While there are several classes of medications to choose from, most experts will recommend the use of a stimulant, including amphetamines, Ritalin, Adderall, methylphenidate, Metadate, or lisdexamfetamine, Vyvanse. Choosing to use a stimulant is based on a rapid onset of action and a long track record of safety and success. Other classes of drugs can be employed as well, including alpha-adrenergics, 10X and clonidine, which are useful in young children, ages 5 to 6, especially if anger issues are present. We're going to limit our discussion of ADHD medications to the use of stimulants. Let's start with the rapid and short-acting forms. These should be the initial choice in children under 6 years of age, mainly because children that age are more sensitive to higher doses of these medicines, and longer-acting preparations don't come in the smaller doses they require. Effects from the medicine can be seen within as little as 30 minutes, with a peak effect between 2 or 3 hours. This is important to know, since timing is everything here. This is another question to ask your physician and to keep in mind as you monitor your child's day and needs. It's like opening 100 tabs in your browser at once and trying to do something different in each one at the same time. Then